The Bahamas will have more COVID-19 cases, but the hope is they're not as severe as they have been. And this as the country heads into another weekend lockdown. Good morning, everyone. I'm Akush Lopinder with your morning edition. Some 26 additional COVID-19 cases averted during the Easter holiday lockdown. When you consider the fact that heading into Palm Sunday, there was exponential increase in cases, health officials would admit that this in itself is a feat. But after weeks of lockdowns, Bahamians have long grown wary, with the biggest question being, when will it end? To that, here's what consultant and former Chief Medical Officer Dr. Mercelin Dow-Regis had to say.
If we continue with what we're doing now, the social distancing, the avoidance of gatherings, we should follow the yellow line. If we don't, and we increase our cases by 2 per day, we would follow the middle line. And if we have a rapid increase in our cases, you can see, look to the left, the ordinate, you would see the number of cases we will have 60 days out from here.
Now, based on the model's worst-case scenario, puts the number of cases at that point at well over 100. But health officials are hoping for an intervention, one that will cause that yellow line Dow-Regis speaks about to dip lower. And that, of course, calls for compliance.
Although we might have more cases, when you test more, you identify more cases. But what we are looking at, what we think is critical, is that we don't have very sick cases that overwhelm our health facilities. And we also identify folks and save lives. And that is one of the reasons why we are targeting the elder care grouping as a priority group, because we're looking at projections everywhere, all over the world, and we see that this group is particularly vulnerable. So I'm not able to give you what the projected timetable, but if we're looking at 66 days out, that's mid-May. If we look at what we might achieve, we truly hope it's under the less than 160.
Well, ramped-up testing will target those in assisted living homes, healthcare workers, and the prison. The ultimate goal is to get a clearer representation of what's taking place here.